Leah.
Hi, hello.
Where are you coming from today via Zoom?
Yes.
What part of the country?
I'm actually calling from New York City, Brooklyn.
Oh, sure. For New York City. Great. Thank you so much for taking a minute with me. I appreciate it. You're a care partner for someone in your life that has PCNSL, correct?
Yes, I am.
Who is the patient?
Is actually my mom's younger sister. I've actually been caring for her for a couple of years now.
So
She's my aunt.
the patient is your mom's sister?
Yeah, she's my aunt.
Oh, your aunt. Okay. Yes. Okay. And how long has she had PCNSL?
Roughly for about, I think 15 years to 18 years now.
18?
How long she has had, sorry, I'm so sorry. About 10 to 8 years, I think. I'm just started thinking of how long I've actually been in contact with her.
For about 10 years, maybe?
10, 8 years, yes.
Wow. That's great. Okay. And
Mhm.
so I have a couple of questions to ask you, but before I do you have any questions for me?
No, I probably think as progressing, I will have questions, but right now I don't have questions.
Okay, that's okay. So
Thank you.
one of the questions I have for you, it was in the survey, it was kind of subtle in the survey, but I'm going to ask it a little different way if I could. So for you,
Mhm.
as the care partner of your aunt, what would you have liked to have had when she was diagnosed from her healthcare provider?
I would have liked to have like a background training, probably
Oh,
where I'm being taught how best to handle certain issues when they arise and how best to just respond to certain changes in probably medication, in hospital visits, just understand what I'm doing better. Because initially I had zero to no idea, but I had to learn over time. I had to try to understand, take notes, understand changes in education process and all. But I feel like if prior to that, I was actually given probably a pamphlet that I could read and just guidelines, simple notes, just to ensure that I'm well equipped for my duty as a care provider.
I heard you. Can you give me an example of one thing you didn't know and you would have liked to have had training on that you had to learn all by yourself?
Okay, one of the aspects I would say that I would love to have training on would be the aspects of medication. Now, if I actually over the years I got to understand what is needed, what is not needed, when it should be given. But I feel like giving me a background check on while these medications are being prescribed, so I understand why she's taking it and what she's taking it for, not just knowing that okay, she should take this at this time, but I don't really know what it's trying to attack or what it is for. And then in the aspect of certain drugs have different side effects. I do know that in hospital visit they say a little about this, but I feel like giving me like a range of expectations because sometimes
I think I heard you. Let me repeat what I think I heard you. We did have an internet glitch, so we kind of froze for a bit. So I might not have captured it all, but you tell me that, okay?
all
So
right.
for your example, you would have liked to have had from the healthcare provider training related to the aspects of expectation and why certain medications are being prescribed and what they are specifically for, and training on the dosages, the side effects, and the timing on when to give each drug.
Yes.
Is that
And probably what happens if I'm late by a few minutes, a couple of hours or something, what would happen probably, just so I know the pros and cons and I know what I'm dealing with.
okay? Okay. So that's wonderful and good information. So you didn't get any training on that, huh?
No basic training. I just got
Yeah.
used to the system basically.
Yeah. Okay. Oh, that's a huge deal. That's a huge unmet need. Everyone would need training on that. I agree. Absolutely. Okay, second question for you. It's similar, but maybe it's different. If you were talking to the pharma industry that makes these drugs, right, for disease, and specifically we're talking about the PCNSL patient community, what do you wish they knew?
Well, one thing I would wish they knew is that every patient is different. And I believe personally that psychologically, everyone responds to different medication. Like my aunt and a friend of hers, and her hospital friend, actually like a pal, but they have the same symptoms and diagnosis. They take different medication, and I got to understand that it was because their body system was actually made up differently and they respond differently to different treatments. So I would actually ask the pharmaceutical industry to try as much as possible to ensure that they put this in mind and probably test out as many of their test subjects with different psychological background or different psychological feelings. And I would also try to ensure that they are using as much natural supplements as possible. And kind of, I don't know how the cost of actually manufacturing, but I think that the price for a few of the medications are quite on the high side. If a little bit of breaking down in price would actually really help a lot. But apart from the pricing aspects, I feel like their surgeons should actually be tested with the different drugs based on their psychological well-being and probably genetic makeup, because some drugs react differently to a different set of people, and it works better in some set of people. So I don't really understand that kind of variation, but I feel like something should be done that every drug actually works the same way for everybody.
But it doesn't.
Kind of a little bit, because yeah.
One of the things I think you were saying it, I heard psychological, but I think you might mean like physical. Everyone is physically different, you know, and biologically different. Therefore, the drugs do behave differently for everybody. And I think I might have heard you say, I translated it a little bit differently, but I might have heard you say that you wish the pharma who is developing drugs for the PCNSL patient population, that they should be trying out those drugs in clinical trials that have a diverse population in the clinical trials, correct?
Yes.
Is that what I did hear you say? Okay.
Yes.
I got it. That's what I wrote down.
Yeah.
So I just wanted to make sure that that's exactly what you said, which is an incredibly important point to make. So thank you for sharing that. I agree with you. I agree with you. Pharma companies need to create their clinical trial protocols that include diverse populations within the clinical trial. Absolutely agree. Thank you so much for saying that. Is there anything else you want to share with me or want me to know before we say goodbye?
Are you asking regarding what I would want the pharmaceutical companies to do?
Are what?
You asked if I would want to share anything more. Is it in regards of what I would want the pharmaceutical companies to do?
You can add anything you want.
Well, I do feel that the patients also they should actually have a kind of time where they are brought together to just have basically not exactly medical inline workshop, but workshop where medical practitioners just organize probably a simple picnic where a few of them with similar diagnoses just come together, share their stories, probably talk about drugs they've used, how they have actually gone over the years, because I feel like hearing what another person with a similar diagnosis is going through would actually motivate you and give you as a patient a little standing on where you are, and it makes some kind of community where you know that you're not exactly alone, but you have other people behind you and other people that could support you in your time of need. I know my aunt has like a small group in where she actually goes take her medication. But I feel like more could be done, like probably online social groups, or maybe in a small community kind of setting in a neighborhood or in a larger scale.
Okay, okay. So it would kind of help, it's a gathering, it's a workshop, it's a support group. It's a way to create a network of people who are experiencing some of the same things, right? From everyone, you know, what their experiences are, what their patient support, what stories are, what their care partner stories are, what helped one person, you know, again, it might not help the other person, but at least you would hear about it and know about it. And
Yeah.
another thing I do think that's really important about creating perspective, you know, you're not alone. You know, there's other people every single day experiencing something very, very similar, if not the same thing as what you are or the patient is, right? So that's incredibly important to know that, but also to be connected to that as well. Okay, I hear you. I wrote it down. That's fantastic. Thank you, Leah. Your insight is beautiful. And
Thanks.
your aunt is so lucky to have you taking care of her.
Thank you so much. I try my very best. Thank
That's
you.
what we all do, right? We all try our very best to help the PCNSL patient and care partner community for sure.
Thank you so much.
All right. I really, really want to thank you for taking care of your aunt and
Thank you so much.
also through participating in this kind of work. It'll help other patients and care partners in the future. So thank you.
Thank you.
Yeah, you
Thank
bet.
you.
Have a great rest of your day.
I will. Bye bye.
Thank you. Bye-bye. Thank you.
Thank you.